HIPPA, a presentation by Michael Richards, Sarah Driggers, Braden Keller, and Kenneth Whitaker. HIPAA is the Health Insurance Portability and Accountability Act of 1996. It was enacted on August 21, 1996. Sections 261 through 264 of HIPAA require the Secretary of HHS, to publicize standards for the electronic exchange, privacy, and security of health information. The Department of Health and Human Services created the HIPAA law to help protect the patient and the healthcare organization. Our presentation will focus on the privacy portion and the portability of the law. Who does the privacy portion apply to? First, it covers the patient. Second, the healthcare providers. Third, it covers health insurance companies. And fourth, it covers healthcare clearinghouses, which are organizations that handle healthcare information for research and data purposes. Any person or organization who handles medical information or data will be covered under the HIPAA law. What information is being protected? Any individually identifiable health information in any form or media, including electronic, paper, or even oral. This means the patient's past, present, or future physical or mental health or condition, the provision of health care to the patient, or the past, present, or future payment or for the provision of health care to the patient, and any information that could be used to identify the patient, including social security numbers, addresses, and even the person's age and gender. What is the goal of the Privacy Act? A major goal of the privacy rule is to assure that the individual's health information is properly protected while allowing the flow of health information needed to provide and promote high-quality health care. The rule strikes a balance that permits important uses of information while protecting the privacy of people who seek care and healing. Given that the health care marketplace is diverse, the rule is designed to be flexible and comprehensive to cover the variety of uses and disclosures that need to be addressed. It allows the patient to understand and control how their healthcare information is being used.
All right. Hi, this is Braden Keller, and I'll be talking a little bit about portability in HIPAA. So first of all, if you remember, I want to remind you of the video we watched kind of at the beginning of the class called Sick Around America. And we noticed in that video many examples of people who were left high and dry without insurance or coverage when they either lost their jobs, switched coverage plans, or all sorts of instances. Well, portability in HIPAA is a little bit of a help with that. A definition from the Kaiser Family Foundation says, portability in the context of health insurance describes the ability of an employee to maintain access to health insurance coverage and comprehensive benefits after leaving a job. It also applies to the ability of those purchasing insurance on their own to drop one insurance policy and buy another. So there are two instances in which portability primarily applies, and that's one, when you leave one group health plan coverage to another group health plan coverage, usually when you're switching jobs. Or two, when you lose your group health coverage and therefore you need or want to buy individual health coverage, for instance, if you've lost your job. Alright, so some benefits and protections offered through HIPAA include a couple of the followings. Number one is there's no imposed exclusions based on pre-existing conditions, which means that when you're switching your health coverage, for instance, when you switch jobs and join onto a new group health plan coverage, they can't impose exclusions because of pre-existing conditions that you had before you joined your first group health plan coverage. Number two, whenever you join a group health plan, there are special enrollment periods in which you are able to join on. But when you're switching or you have an emergency or you need to include a dependent, portability allows special enrollment opportunities, which means you can join on to the group healthcare plan outside of those special enrollment periods. It also protects against discrimination, which means that the organizations of health coverage can't deny you coverage, withhold benefits, or charge you more than everyone else due to your medical history or your lifestyle. For instance, if they know that you ride a motorcycle and maybe you could be a little bit more of a liability, they can't discriminate you against that. In the picture, little thing that says included broken finger, not included your history of heart disease. So it protects you as you transfer coverage plans. Alright, now it's important to remember what portability and HIPAA do not do, as there are some confusion. And number one, it does not guarantee you the same plan or benefits that you previously had in your old job when you get a new one. Second, it doesn't force your employer to provide health coverage at all. And third, it does not regulate the cost of insurance coverage, which means you're not going to get any huge discounts because of portability in HIPAA. Now, something that helps me to remember the principles of portability in HIPAA is remembering PowerPoint, the extension or acronym PPT, which is Portability Protects Transition. As you transition between health insurance plans or coverages, or from a group plan, for instance, to an individual plan, portability gives you benefits and rights to help you go through the process so you are not stuck in a prolonged period without health coverage.
Hi, my name is Kenise Whitaker, and I'm going to be talking about some common HIPAA violations that can occur in the workplace, and this has to do with the privacy part of HIPAA. So some of the most common HIPAA violations are lost or stolen devices, hacking, employee dishonesty, improper disposal, third-party disclosure, unauthorized release, and unencrypted data, lack of training, unsecured records, and just loud mouth. So I'll just take a second and talk about each of these things individually. So lost or stolen devices, this can happen where information that might be stored on these devices, they're not actually required to be encrypted on the devices or have a password, but it's a good idea to at least have your mobile devices, if it has confidential information on it, that you password protect it so that no one else can have access to that information. The same goes for hacking. If you can change your password frequently, make sure your password is not weak, then that prevents hackers from wanting to hack into your computers at your workplace. They want to use the path of least resistance, so if you have a complicated password or one that is strong, then they'll be less likely to hack into that information. Of course, employee dishonesty is definitely one that you can't necessarily prevent, but with proper training and making sure that you are being honest in your dealings, then you can prevent this from being you in this case. Improper disposal seems like it could be an easy way to have a HIPAA violation. This can happen even with copy machines that have information stored on them in their internal databases. So that is something to be aware of. Also, shredding of paper and even flash drives, disposing of that information properly can help avoid this violation. Third-party disclosure happens when you might have a partner that you are, or another business that you are partnering with, and perhaps that person ends up being the leak, but you're still responsible to make sure that that business partner is compliant and keeping that information private as well. Unauthorized release happens when news media or a leak or something like that gets out. If you're even an employee saying something on social media, could be an unauthorized release. So just making sure that you're not that person who is causing that leak. Unencrypted data, it's not required to encrypt the data, but that's an easy and inexpensive way to help protect the information that you have in your in your company, in your databases there. Lack of training I talked about briefly as a way to prevent some employee dishonesty, but sometimes people just may not know that they can't talk about it. So making sure that the employees know that about HIPAA and about the privacy of the patients is important. Unsecured records also kind of goes along with what we talked about before with not having encryptions or passwords, but also this can happen if you have electronic paperwork or documents, if you're emailing them, something like that. Make sure that's a secure connection. And of course, the one that we'll have to control for ourselves is to make sure that we keep our mouths quiet and not gossip, and making sure that we're keeping in mind the privacy of the patient at all times.
Hi, this is Mike Richards. Can everybody hear me?
Yes, you're good.
You're coming through good.
I'm sorry, say that again?
We can hear you well.
Okay. So this part of the presentation is talking about what is commonly referred to as COBRA, but it actually stands for Consolidated Omnibus Budget Reconciliation Act of 1985. So it started obviously in 1985, and it was a law that was passed by Congress, and it was signed by President Ronald Reagan, and basically it mandates that an insurance program that employees have the ability to continue coverage if for some reason they get laid off or they are in the process of switching jobs, something, to that effect. Some of the detailed information, the laws and different things, I really didn't understand a whole lot about. And one of the things that it talked about was this Title X, which amends the Internal Revenue Code, and then Public Health Service Act, and it talked about how denying income tax deductions to employers with, I guess, 20 or more full-time equivalent employees. But like I said, I really had a hard time understanding this aspect of it. So I apologize if I can't explain this part of it too well. If we can go to the next slide. So basically, like I said, it gives employees the opportunity to keep their health insurance, if they lose or quit their job. Basically, let's say if you got paid, twice a month, your cost would be $250, and then your employer would pay $400 towards the premium. Following a qualifying event, an employer has 30 days to notify its health insurance plan administrator of the employee's COBRA eligibility. And I actually had an opportunity, gosh, it had to have been maybe 10 or 15 years ago, where I actually had to use COBRA at one point as I was in between jobs. Okay, so Basically, if you qualify, anyone with you and anyone in your family can extend the coverage for an additional 11 months. It is possible that you would have to pay up to 150% of the premium for those additional 11 months. So it can be quite expensive at some point. Your spouse or dependent can also, if they qualify, they can extend the coverage of up to 18 months under certain circumstances. So a lot of people, I guess, wonder why it's so expensive. Basically, because you're paying for the entire premium of the plan. COBRA, they can charge an extra 2% in administrative costs. There are other options that you can look at besides COBRA. One thing that you can do is obviously research to compare policies. I believe, if I understood it correctly, there are other private insurance plans that you can get besides COBRA.